Welcome to One Day One Topic by BPA Buddy. So today the topic is young long bone. It is very important. So please pay attention. So parts of growing young bone has epiphysis, epiphyseal plate, metaphysis and diaphysis. Let's start with epiphysis. These are the ends of long bones that ossify from secondary centers. Here we can see this is our epiphysis. Diagram is also very important. So have a look on the diagram along with the content, because if you know the diagram it is easy to remember the content. So ends of long bone that ossify from secondary centers is epiphysis. Then epiphyseal plate. Epiphyseal is also known as growth plate. It is a plate of hyaline cartilage present in between epiphysis and diaphysis of a growing bone. So here we can see it is a plate of hyaline cartilage present in between of epiphysis and diaphysis of a growing bone. This is our epiphysis. This is our epiphysis. This is our diaphysis. Epiphyseal plate lie in between both of them. Epiphyseal plate is made up of hyaline cartilage. Proliferation of cell in the epiphyseal cartilage is responsible for growth in length of long bone. So the name only suggests that it is growth plate, so it is responsible for the growth. Then comes our metaphysis. Metaphysis is end of diaphysis towards the epiphyseal cartilage, which is called as metaphysis, most actively growing area in the long bone. So here is the metaphysis. It is most actively growing area. Okay, and it is end of diaphysis. End of diaphysis. Diaphysis, it is elongated part of bone. Diaphysis, it is elongated part of bone between metaphysis, and it develops the primary ossification center. Ossification means process of formation of bone. So primary ossification center is diaphysis, which is elongated part, part between the metaphysis. Okay, then comes the blood supply of long bone. Blood supply is also very important. So here we can see epiphyseal artery, metaphyseal artery, nutrient artery and periosteal artery. All of this is very important. Epiphyseal artery, it is derived from arterial anastomosis around the joint. Here we can see the epiphyseal artery. If you only remember the names also, it is very much enough for blood supply of bone. So and remember the diagram is very important. Here you can see the epiphyseal artery. Epiphyseal arteries, they derive from neighboring arteries and enter metaphysis directly along with the attachment of joint capsule. So here you can see that our metaphyseal arteries are deriving from the neighboring arteries, and they enter directly along the attachment of joint capsule. Then comes the nutrient artery. It enters the middle of the shaft through the nutrient foramen. This is the nutrient artery, and this enters inside middle with the help of nutrient foramen, and runs obliquely through the cortex, and then divides into ascending and descending branches in the medullary cavity. Each branch then subdivides into several smaller vesicles. Each enter the metaphysis and form hairpin loops. Few words are important to remember, so if you remember the keywords also, it is fine. Then comes periosteal arteries. There are numerous and beneath the periosteum. This is the periosteal arteries. They are numerous and they are beneath the periosteum, and they enter bone foramen canal to supply the outer 1/3 of cortex. So this was the topic for today. I hope this series is helping you. Meet you in the next one.